Hello, everyone. My name is Tommy Joe Bednar. I work at Apt Associates, and I want to welcome you today to our ESG-CV Reporting Office Hours webinar. And I'm just going to cover a few logistical and housekeeping items before we get into the meat of our presentation and office hours today. So first and foremost, we want to make sure that all of you can hear our wonderful presenters as they share some information and answer your questions today. We know that computer audio doesn't always work the best for everyone, so if you're having trouble hearing or want to make sure that you can keep a great audio connection, you can go ahead and call in at that number on the screen using the phone number and the access code there. I've also gone ahead and shared that phone number in the chat for everyone for reference further on. I would like to note that today's webinar is being recorded and will be posted to the HUD Exchange in about 2 to 3 business days, along with the materials, including the slides from today's webinar. We do want this to be an interactive office hours, and that includes having opportunities for all of you to ask questions. One thing to allow for that is the hand-raising feature in WebEx. So if you would like to draw attention that you have a question to one of our presenters, you can use the hand-raising feature. That way they'll be able to call on you, and if you would like to ask your question verbally. To raise your hand in WebEx, go ahead and take your mouse to the bottom right-hand corner of your screen, and you'll see a little hand icon in that bottom right-hand corner. If you click on that, that'll virtually raise your hand, and we'll call on you if we have the opportunity to ask your question. And then when you're done, or you don't have a question anymore, go ahead and click on that again to lower your hand. To ask a question verbally, you will need to connect your microphone to audio. So even though you might be hearing us now, you'll have to connect the microphone by using your audio panels. Everyone has that capability now, even though you're muted. So if you'd like to ask it again verbally, please connect your microphone. We do know that not everyone may want to ask a question verbally, and we want you to be able to ask and have questions answered through all varieties of methods. So we also encourage you to use the chat feature to ask questions, make comments, share experiences. And to use that chat feature, click on the button that says chat and has a little chat bubble in the bottom right-hand corner of your screen. That'll pop up your chat for you. And please make sure that all of your messages are sent to everyone. You do that by selecting the to field, and if it's not already set to everyone, go ahead and set it to everyone. That way all of our panelists can see your questions along with your other attendees, and the answers can go out to everyone as well. I want to share that our presenters and our leaders for our office hours today will be William Snow from HUD Office of Special Needs Assistance Programs, Michelle Budzik from the Partnership Center, Meredith Alspa from the Partnership Center, and we also have some Apt Associates and Partnership Center staff doing some tech support as well as chat Q&A support today. With that, I'm going to go ahead and hand off our webinar to William Snow.
All right. Thank you, Tommy Joe. Excited to see you all today. Quick reminder to begin the call. This call is focused on ESG-CV quarterly reporting. We will not be answering questions tied to the notice or other questions you have that are not directly related to reporting. If we happen to know the answer, we will attempt to answer it, but the purpose of this call is to talk specifically about reporting. So if you do have those other questions and we cannot answer them here, send in an AAQ or participate in the office hours tomorrow where those types of questions can be asked. We do still have a bunch of questions that can't be answered tied to the policy, so just we ask you to continue to be patient with us as we get some of those answers. But your questions are great. We do want them. We just have context for them at times. So today, we just wanted to kind of step back and take a look at some of the things that we've clarified or changed since our first webinar, just so that you have those reminders, but they also happen to be things that a lot of AAQs are tied to as well, a lot of your questions. So we thought it would be helpful to do some quick overview of these things. So next slide, please. All right, roles. We've gone over this in every single webinar because roles are so big, right? It's such a large part of it. Recipient is first. Recipient gets the money directly from HUD. The recipient starts the process in stage. The recipient is the make or break everything to this process because the client level data is totally dependent on what is set up in a bundle, and it is the recipient who sets up the parameters of each bundle in Sage. So I can't put enough stress on that one. Recipient goes in, sets up the bundle in Sage, and then the other players involved, right? This could be your HMIS lead, there may be multiple HMIS leads, or a victim service provider, or multiple victim service providers. They're going to get bundles that are based on what was set up in Sage by the recipient. So again, recipient holds all the power there and decides all the things that are included. Remember that a bundle can include as few as one project or as many as needs be. So there has been a question about, like, do we still have to bundle if we're a single project that we're reporting on? Yes. Bundle is just a generic term we're using here to include one or many projects in a single component type. So just a quick reminder there. Subrecipients, you're going to collect data like normal, but hopefully subs aren't on this call, but if you're a sub, you don't actually have to do any CSV upload for this unless you're a victim service provider. If you are a victim service provider, you're going to participate like normal. Collect the data, provide the CSV, and that's going to be your job. HMIS leads, you're going to have the blessing of bundling by component type within your HMIS implementation. So as recipients, you need to know how many HMIS implementations have projects. So if you are a CO or an ESG recipient across a state that has 10 HMIS implementations, it's possible you have 10 projects and they span all 10 of those HMIS implementations. If that's the case, you're going to be entering the contact for all 10 of them, and all 10 of them will get at least one bundle. It's possible that you're only funding, let's say, 2 projects out of that 10. In the first reporting period, you really only need to make sure you have the contacts set up for those 2 HMIS leads, because they're the ones who are going to get the bundles. So just as a matter of course, like figuring out how do I set this up, who needs to be in, if a lead has a project that they're going to have to report on, they're the ones who must be involved in the process. So you must bundle projects, and they need the email so they can give you the CSV data. So those are the roles. We've talked about them a lot. We'll talk about them a little bit more, but let's go to the next slide, please. Temporary emergency shelter. So this is something that we did change what we said from the very first webinar. Once the ESG-CV notice came out, we got some clarification. So this is what's required. There is a definition in the notice. It's posted up here, but the key principle to know, are you supposed to set up a project as a temporary emergency shelter? Depends on 3 core criteria. That first one there, again, I'm going to read it and focus on it. So whole or in part of a structure is used to provide shelter to individuals and families displaced from normal places of residence or sheltered, unsheltered locations due to a natural disaster or public health. So let's take out a couple key concepts there. There is whole, a structure, whole or in part, right? So it doesn't have to be the whole thing. It's providing shelter, and they're providing shelter because of COVID, right, the public health emergency. So right now, there are actually a ton of disasters going on, more than I'd like to talk about, right, because it's unfortunate. But this requires a tie directly to COVID, right? That's what the CARES Act funds are for. So providing shelter to folks in part or all of a shelter due to COVID. The second piece requires that a public health official determines that temporary emergency shelter is necessary. So there needs to be some indication from a public health official. We're actually working on guidance and documentation for that. We hope to publish that shortly, so you'll get a better sense of that. But there does need to be some sort of message or declaration that says, yes, there is in fact a need for shelter to address the COVID crisis. And then the third element is it actually has to happen during the COVID period, right? So you can't ask for reimbursement or set up a project that started January 1, 2020 because we don't recognize that as being applied to COVID-19. Something between January 21st and going forward. So those 3 core elements are what you need. This, unlike our early statements, it's not dependent on whether or not it fails habitability. You simply do not have to do a habitability inspection. Same with environmental review. You just don't do one. There's no documentation tied to it because it's simply not required. So that's the quick and dirty of temporary emergency shelter. Let's go to the next slide, please. All right. This is a fun one. So this is the, do I have to report question. So let's quickly run through the flow chart and figure out where you fit, right? Each of you can mentally follow along with, do I fit in this category or not? So there are still a group of recipients that have not executed the grant agreement. It's 10/1, so the reporting period ended yesterday, 9:30. So if you still do not have an executed grant agreement, you have no report. There's nothing to report on. Done. So what if you have an executed grant agreement and you have nothing else? You've not spent $1. You don't have other things set up? That's fine. You do have a report, but it's very small. You go into Sage, you say, I've executed the grant agreement. The next follow-up question essentially is, have you spent money? And you'll answer no. So you'll go in, you'll enter all zeros in the financial form, and you will submit. You'll be done. So I know that there are many ESG recipients still in that category today. You should finish your reporting today. You don't have any bundling to do. You don't have any other thing you have to report on. If you haven't spent $1, you're still going to have to submit, and you can do it now. So I'd encourage you to do that. There are those of you who then have to think through, well, I spent $1, right? I've executed grants. I've spent at least $1. You need to answer the question of where or how is that dollar spent, or those dollars. Was it on some of those special costs allowed through the ESG-CV notice and only on those costs? So let's say training. Maybe you've trained various staff in your catchment area or your jurisdiction, but that's it. You've done nothing else. Well, if that's it, you will not have to do a CSV upload. You will have to report, and the report will tell us how much money you spent. And you'll also have to respond to a narrative that essentially says, why did you do this, and how was it tied to preparing for preventing and responding to coronavirus. That applies to all of those unique activities. If you've only done those activities, done nothing that you would do under a normal ESG program with your ESG-CV dollars, then it's pretty simple. You don't have a CSV upload. This also applies for HMIS and admin costs. There's no CSV requirement for those, so if you spent money on those, you'll tell us what you did, and then you'll hit submit. If you've served at least one person with those dollars, you're going to have a CSV upload. You're going to have a financial screen. You'll essentially have to do the whole thing. I think that's logical. Everyone kind of knows that part. So hopefully that clarifies where you are today, and I, again, hope mentally some of you went through that and kind of said, oh, I don't have to do any reporting. I'm done. Or I need to figure out who my subs are and start talking to them about who they've served, do they have everything in HMIS, how much money. So remember, we don't give you anything on how to get your financial data, right? We help you with what's required for HMIS. You have to figure out how your subs report to you your financial data. If they've spent money, even if you don't know what that is, but you've authorized them to spend money, and they indeed have spent money, that you're going to have to find a way to get that information from them. And you will have to report it to us, even if you haven't reimbursed yet. We know many of you, like HUD, we take time to reimburse. You also need time to reimburse. It's not about whether or not you've reimbursed people. It's about whether or not you've authorized them to spend money and they have, in fact, spent money. With that, I think we'll run into a few more details, but we'll have Michelle take over.
Thank you, William. We're going to talk a minute about bundles here. William kind of has gone over this, but a bundle has three attributes. The recipients identify the project by the component type, the date of the project, and the HMIS lead or victim service provider it's going to go to. That is what Sage is going to use to create the bundle. So the recipients identify all of that information in the forms in Sage. in some ways you don't even know you're doing it. We're asking you the questions, it's doing it, and you're going forward. Then you tell Sage you're done, and Sage creates the bundles for you. When Sage creates those bundles, it sends an email to the HMIS lead or victim service provider, who then needs to generate the bundle from your HMIS system. The bundles are always going to be run for the same component type, so when the HMIS lead gets them, they're going to get a bundle maybe for emergency shelter and another one for RRH and another one for homeless prevention. That's fine. There's 3 different bundles then that they're going to have to generate for you. If you have many HMISs across your state, you might have many emergency shelter bundles that are going to come in. And that's the concept of a bundle. The report bundles data by quarters. So for your quarter report, for this initial report, it'll go from the report start date to the end of the period, 9/30. And then after that, it will go for each quarter, October through the end of December, right? It will be the next quarter. So you'll always submit a quarterly report. By the time you submit next time, the HMISs will also be asked to generate a cumulative report. So it'll be adding together and unduplicating all the way across that period from report start date to the end of that first quarter, which would be the end of the year. The report start date cannot be before January 21st. That's the law. We didn't just pick that. That was in notice and stuff for you. The date should either be the first date of the regular ongoing emergency shelter or street outreach project recorded in HMIS, and we have given you talked through a worksheet about how to do a calculation on that. If you need to refer to that, those would be in previous slides. Or if no emergency shelter or street outreach funding was provided prior to October 1st, it's the first date of any other component other than emergency shelter or street outreach that began servicing clients. So if you didn't fund a shelter in the first period, the initial period, but you only funded RRH projects, then it would be the start date of the first project opening for RRH. I think this is the question that the issue that we've gotten the most questions on. So we want to say it again, that we hoped that by now you would have moved through, your grant agreements and contracting with everybody, and that by the end of 9/30 you would be reporting financial information and uploading CSVs. We recognize that that's not the reality of the country and that many of you are not there. But what William said earlier is really important. The reporting expectation is that all expenditures made in the reporting period, even if your subrecipient didn't bill you and you didn't pay a bill, you didn't draw it from IDIS, it's still got to be reported. So if you have contracts with subrecipients that go back before October 1st, there should be expenditures that have been made, and you would need to get from them the amount of expenditures, and then you will need to submit CSV files for those projects for the clients that were served with those expenditures. We also changed how long it would take for an HMIS lead to review the projects once you sent the email with the bundles on over to them. And we originally said within 24 hours, and we listened to the HMIS leads who said, oh gosh, we need more time, and so we went to 3 days. So from the point that the email goes out That's whenever on a day, and then we count day 1, day 2, day 3. At the end of day 3, we're going to lock that lock the system so that the CSV uploads can come in. You can't upload a CSV file until your HMIS person can't upload the CSV file until the lock comes off and it's opened. The purpose of this lock is so that if the HMIS or victim service provider, I guess, recognizes that there is an error somewhere in the bundles, like they got a project that doesn't belong to them, you're going to have to pull it all back and regenerate these bundles again. And so we don't want anybody doing work 2 and 3 times because you've pulled it back. So that's the point of this lock and this like holding period, to get the HMIS folks to just verify that what you sent them really belongs to them. And we're going to take questions now. I see that as I was talking, I can see out of the corner of my eye a bunch came in. So Meredith.
Meredith, we can't hear you.
Double mute. Sorry about that. So there were a couple of questions on the expenses still. So just to clarify, for expenses incurred by subs, they should be included on the report. In order to be included on the report, they should have a contract in place for them right now?
Yep, there needs to be a contract and there needs to be actual expenditures.
Okay. So they do not, this is a follow-up question from someone else. Do we include all subrecipients or only those who have had expenditures?
Yeah, only those who have had expenditures.
Yes, okay, thank you. There was a couple there that I think William answered, and then my screen just moved on me here. But there's one, are weekends included in the 24 hours count?
No weekends, no holidays.
And it's 3 days, not 24 hours anymore.
That is correct.
Okay. Regarding reporting and your instructions to not report if a grant agreement has not yet been executed, if we plan to include pre-agreement costs in the agreements, does that change anything?
Nope. You'll end up telling us about it next time. And actually,
okay.
So I should have said this earlier with your discussion on expenditures. So the very first question that came in was about draws versus expenditures. So when we say expenditures, we mean literally funds were spent on clients. It's not about reimbursement to you by HUD, not about reimbursement from you to a sub or from a sub to a sub-sub. It's not about reimbursement. It's about funds spent on clients or on eligible activities. That's what we mean by expenditures. And we know, again, the pre-award stuff makes it a little fun to that question that you just asked, Meredith. You can't, if you have no grant agreement, and again, the grant agreement between HUD, yeah, you don't have anything to report. So that's a good question.
Another one here. These are quarterly reports. Are we required to submit monthly reports as well?
Wow. I'm surprised you're not like getting tomatoes from wherever you're sitting. That'd be awful. No. I think quarterly reports will probably take all of the time during the months in between, more time than perhaps we would like to think about. So quarterly reports is painful enough. We're not going to do more than that. And to be clear, we're not even doing annual, right? We're not doing 4 quarters and then an annual report. We are doing quarterly reports. And included in the quarterly reports following this first round, you'll submit a cumulative set of CSV files in addition to quarterly. And we did that because people always ask how many people have you served to date, and we need to kind of avoid duplication. But we also, if we do it that way, you don't have to give us a separate annual report. We can just say, oh, yeah, we know how many people have been served.
Thank you. So this person says, we have recently executed an emergency shelter contract that will include costs incurred from March. I am waiting on invoices with these costs from the subrecipient. If this is the only cost incurred from our CV contract, can we wait until the next reporting period to report?
No. You need to report by the end of the month. So if you need to call them and get them to tell you what those costs are over the phone rather than sending you an invoice and hope that it's close to right, that's great. But you can't wait.
Yeah, there will be, so we know that for some folks there will be this recognition that you'll find out about costs or you'll determine that costs will be eligible from earlier periods. That's going to be complicated to fix. We've mentioned that in the past. We will have a workaround for that, but again, it will be complicated, and we want to avoid that. For now, we really do expect you to go and find out what costs have actually been spent under this grant. That's really important. It is important to note that this is something Congress is looking at heavily at. I don't know if you guys have looked at the HEROES Act. The last version of that had $50 billion in ESG for rental assistance. It used to be $100 billion. One of the questions that they're asking is, are people spending money for one reason or another? And we've tried to give valid reasons for why money hasn't been spent. But I would just say, for your own sake, there is a very, very focused lens on, is this money needed? Is the money being spent? So it will benefit you to be able to tell us that, because if we get an inquiry from any given jurisdiction, we will answer it based on the quarterly reporting data we have, and we want to be as accurate as possible. So again, we want to help you, but we also need your help in ensuring that we show this money means the world, right? This means the difference for people sleeping outside or having a house over their head, right? It's very, very important. But without being able to say expenditures, incurred, people start to turn around and say, oh, no, they just don't need the money. And we know that's not true, but we need a way to kind of validate that too.
Thanks. Michelle, I want to get some clarity for one of these questions here. Someone has already entered all of their subrecipients in SAGE, but this is one of those cases where they didn't all expend any funds. So is that a problem that they've entered all of their subrecipients into SAGE, even though they don't have any expenditures?
Yeah, SAGE is going to put them in a bundle with the operating start date of the report and send that bundle request on over to the HMIS to get information that you don't need to report. Either they don't have because it's an RH program that they haven't started collecting, or it's on a shelter where they have been collecting data and you don't want that. So you really do not want to put in people in the reporting period that have not been funded. It's really important that you kind of do this in segments, and this first one is the hardest one because you know what you're going to do down the line, but you haven't done it yet. Put in what you've done.
I am not currently seeing any questions that haven't been addressed either in the chat or out loud.
Then I'm going to take this time, if you don't mind, to share the screen about what happens when you go to the second quarter, because people definitely are confused about what's going to happen. So you're looking at my screen from a community that we pretended to submit already. We submitted financials only up here at the beginning. Well, we actually submitted CSVs and financials in this one. But on the second quarter then, what happens is the system is preloaded with all of the HMIS and comparable databases you already put in last time. You don't have to re-enter them. And it's already preloaded with your with the shelters that you or the projects that you funded. So if you had a long list of temporary shelters or a long list of outreach projects or whatever kind of projects you had, emergency shelters, all of those are still going to be here. So if you don't fund a project until October 1st, that project isn't in this list already, right? Because this is the list that was sent that was through 9/30. So you're going to add a new project. You're going to go through the process of just adding a whole new project to the system. You're going to put that project in a bundle. You're going to now tell us, when did that project start? Oh, okay, it started October. Maybe you started the contract October 10th. It doesn't matter. You're going to pick October. SAGE is going to automatically make that October 1st, and that's the rules. So you're going to pick the month it started, and you're going to save that, and now that project is part of the projects. I forget where I was. That project is part of the projects in the system. It's right here. You can't do anything to delete a project, but you can close a project, right? So perhaps this Sandra's Place temporary shelter closed. It closed at on October 15th. You're going to tell us the project ended. You're going to pick a month that it ended. It ended October 15th, so you're going to pick that month. We're going to save that. And then that temporary shelter will show down here. It will be removed from your quarterly bundle. It will still send in data for your cumulative bundle, but it will be removed from the quarter effective as it is. So SAGE is going to, again, rebundle the projects and send them because you've made changes right here that's causing the bundles to change some. So that's how this works going forward.
So that generated a few questions.
I thought it might.
I thought so too. What if you have some projects who have started and some who have not? They all have intents to award but not finalized agreements. There isn't an option to have multiple start dates.
Can you say that again, Meredith?
Yes. Basically, I think, what do you do if you have some projects that have started and some have not? They plan to start, they just haven't, since there isn't an option to have multiple start dates.
So that's kind of what we were showing here is there is one project start date for the first quarter. And you really should think about it as a grant start date because it's more appropriate to think about it that way for the purposes of your reporting, right? So one date for the first period, but and you can only report on things that you have already contracted, right? So if you know you're going to have some subs, but you haven't gone to contract with them, and you haven't figured out what anybody has spent money on or what you're even going to allow, you really can't report on that. There really is nothing to report there because you don't know. So you'll only report on the things you have confirmed, right? So that's subs that are under contract, and they have made expenditures that will be reimbursed under ESG-CV. Those are the ones we'll have to worry about. The other ones we're just going to have to wait on. But many of these projects, especially with rapid rehousing or prevention, they're not going to start until October, next January. Those ones, what Michelle's screen here shows you is in the subsequent quarters, after quarter one, there is a place to create new projects with new start dates, and there's a way to indicate when a project has closed. Something we haven't figured out is if you have a project that's opening and closing and opening and closing, we don't have a way to deal with that. You're probably going to have to enter it a few different times is the reality. As of right now, though, we'll figure that one out. Right now, we're hoping that we don't have projects that are just kind of all over the place. We're just kind of sticking with you're opening once, you're closing once. But it is important to recognize we know that the dates are going to be all over the place. But most of that, we need to nail down quarter one. Figure out what's going on in quarter one, and in the next quarter, as projects start, you're going to be able to indicate that in Sage and as they end. Michelle, is there more that I should be thinking about there or sharing there?
No, just I think, I don't know if it's the advocate in me or the HMIS person in me that would tell you this is a pandemic and your subrecipients shouldn't be sitting around on this money. If you've awarded them money, you should indicate when you expect them to start, and they should be able to do that. It is pandemic money. It's not your regular ESG money.
So a real concrete example someone put in, if their subcontract starts on August 1st, but the sub doesn't have any expenditures until October 3rd, what is their start date?
I'd say October 3rd, because it's not about when you set up the contract, it's you incur eligible expenses under ESG-CV. So you wouldn't include that one in the first quarter, they would be included in the next quarter.
Right.
Okay. Someone referenced a specific example. I'm sorry, that was a while ago. So maybe, Callie, you can re-ask this. But they say for that example that started October 2020, what about pre-award costs that are allowed?
If you allowed pre-award costs, you should have collected. The project didn't just start in October. If you awarded pre-award costs, the project started when those pre-award costs started. So you've got to go back and figure that if they started billing you for shelter supplies because they were using it for masks and distancing kind of efforts, you want to go back and start that. That project technically starts when they started expending money for those masks.
Okay. So this one, we've told our subrecipients they must report all 2020 expenditures up to September 30th by October 20th in order for the cost to be eligible for reimbursement. If they don't report it on time, we won't reimburse them. Is that the expectation?
So I love the framing there. So the reality is that's actually how we'd like this to operate, yes. I will say that we also live in a reality world where that doesn't happen. We know that many of you will find out about some pre-award costs that might be eligible and you will reimburse them, right? And that's not illegal, it's okay. We know that that's probably going to happen. Again, that will cause some pain on the back end and trying to figure out how to make the reports reflect that accurately. But yeah, so my advice would be that's great to tell them that, but at the end of the day, if it's eligible reimbursable costs as a community, you should definitely consider doing that, allowing it, and we'll accommodate as well on the reporting side.
Shay says, I think the biggest confusion is what we do with projects not yet under a grant agreement, thus wouldn't be included in the first report, but that will be soon, and will be able to ask for reimbursement back to March. Does the data back to March just never get reported, or only October forward?
You wish it wouldn't get reported, and so do all of our programming team at Sage. Because our life would be a whole lot easier, but that's not what HUD is saying. They're going to take in a report, and we're working right now on figuring out how you're going to do that. Does it look like an amendment? Does it look like an additional report? How will it actually look in Sage? But we're going to give you the ability to do that.
Okay. I have a question here. It's actually from the subrecipient perspective, but I think maybe this can be tweaked to the recipient perspective. This is a subrecipient that has not been contacted by their state about reporting. They don't have any executed grant agreements. They're waiting on multiple parts. How does this impact them if they haven't been contracted for ESG reported or contacted for ESG reporting at all and still can't spend any money?
So if you're a subrecipient or a sub-subrecipient, this essentially is not your problem. this is a problem that the recipient has on how they contract with you, and then the recipient is going to ask for data from you. If they're going to come back and pay you for previous emergency shelter expenses, that's what you're expecting to get. For example, you're running a shelter, you're going to have to report on all of those sheltered people back then. But since you've already been putting all this data in HMIS anyhow for your regular ESG projects or for continuum projects, or just because your community enters all of the projects in HMIS, you'll have that data and you won't have to worry about it.
Okay. There is a question here again from Shay. There's still some confusion that grant agreements are just getting signed, including with HUD. And Michelle, you said the project should start when the expenses were incurred. However, you also said don't make the SAGE start date before the grant agreement is in place. So those feel contradictory.
No, I didn't say that. I said if you don't have a grant agreement, you can't put them in now for a start date that isn't there. You can't put somebody in that's not under agreement with you. How you're going to do that is going to be more painful then, because you're going to put it in through this amendment process or whatever the process is that the SAGE team and HUD works out together that you're going to have to do. So you're not going to get out of reporting it. You're going to have to report it. So in order to actually be filing reports, you have a grant agreement with HUD that's signed, right? Everybody's got a grant agreement. And then you should have contracts with your subs, and that's where it ends. So if you are a state and you have a contract with a subrecipient that is a city, that city had to turn around and get their contract out to the sub right away. I mean, this is not like we're waiting for 6 months to go through this process.
Yeah, and we do appreciate it's complicated. I think no matter what, it actually would be complicated. So you're getting one version of the complicated options, and we're with you. Like, reporting is hard, and then doing it quarterly. Wow, okay, that's even harder. And trying to figure out, then we have pre-award costs, right? We totally get it. We know that this is complicated. We tried to find the solution that's going to be helpful to you, but we also know, that doesn't mean it's easy, and this is definitely one of those places.
So Carol thinks it could be easier if the SAGE guidance was available. Do you have any update on when that's coming?
Oh, that's exactly right. So I promised to have SAGE guidance coming, and I'm sorry that it's not out yet. As far as I'm concerned, the whole thing is drafted. We just have to get it all approved. I will say there is a reason we started these trainings and these webinars as early as 5 weeks ago. You'll be surprised, or maybe not surprised, to see that the webinars have the most complicated pieces of the reporting from the guidance in them already. They magically made their way onto slides. So we tried to understand where the most complicated places would be and put the guidance up front where we could. We just know that sometimes the approval process for all of this stuff takes time, and we can't guarantee when it will come out based on that. But I promise if you look through the slides, you will find the answers to most of your questions. But I don't know how much experience you have with the HUD grants. I can't remember the last time we wrote a document that answered all of the questions. We don't do that very well. So if what's not in these slides, you're probably not going to get a whole lot more in the reporting document, because we tried to put almost all of it in these sets of slides and materials, because we knew you're going to need it before any guidance document could come out. But that being said, we are committed to getting it to you still, but look to the materials in the meantime in the slides.
and we've tucked a bunch of instructions for you right in Sage itself. So on every page, there's this yellow bar on the top, and in that yellow bar, it either appears right away, or if it's long, you open the yellow bar, and it's going to give you at least the instructions for filling out the page that you're on.
Okay. So this recipient, their agencies are spending funds, but they don't have grant agreements with their agencies. Is it appropriate to go ahead and report on these expended funds?
So it's a great question. We were asking ourselves this question within HUD before this webinar, because we were trying to make sure we understood the answer to that. So the official answer is, really, you should have a sub. Like, HUD doesn't recognize and assign grant agreements, right? The sub should have an agreement with the recipient, and there's a legal binding document that ties them to the HUD expenditures. That's what we have to share. I would say you're going to end up having to report on them anyways if you know the data for sure, you know you're going to award them, and you know what's eligible. Like, I think you have a little flexibility. I would just make sure your documentation reflects this knowledge, right? That these pre-award costs are allowed, and the recipient is aware of that. So, but as I shared, you actually have two choices there, or two options to the single question. You really could wait, or if you're positive the costs will come in and you're literally waiting to sign, just make sure that that's documented in your records, that you're going to be allowing pre-award costs, and you could proceed with it now. So we'll let you make that call.
Michelle, there have been a couple of questions in here about folks that have added subrecipients that shouldn't have. And so I think they would, maybe if you could just show them how you would delete the subrecipients that were added that shouldn't have been added.
Yeah, I'm going to need to change. So is there something else while I'm changing?
Yes. If we spent funds on July 25th, but did not have any clients enrolled until August 23rd, what is the start date? This is like a quiz show.
So I'm not exactly sure how to answer that, because I don't, like, for me, $1 spent is on a client or some other eligible cost. So it depends. Like, you wouldn't report on clients if you didn't start spending money on clients. You might report on other costs. You might have done a training or expended HMIS dollars. You would definitely report on that. But your people, you really wouldn't report on people until 8/23, right? Because you didn't spend the dollar on the people. I guess it's, at the end of the day, neither here nor there, because it does mean that's before September 30th. You're still going to report on people. But yeah, I would probably choose the 8/23 date, because that's tied to the CSV piece, right? It's tied to what you're reporting on clients. But your local records should still indicate however early your costs were. It could have been as early as January 1st. So that's a really good one that I want to kind of put a pin in. The HMIS is not your system of record for your expenditures, right? So many of you might have done some HMIS setup or done some admin work to get things moving anytime prior or after January 21st. The HMIS wouldn't document that anyway. And so keep records of how you expend things. As long as they're eligible and you have the documentation, you'll be able to be reimbursed for them, even if your start date in Sage says 9/30 or whatever date is on there. Good question.
So to delete a project, you're going to, you see that in this example, we've got the projects all entered and the projects are already in bundles. So you can see that you can't mess around with them. You need to return to the Launchpad. You need to go to your project page. and you're going to have to delete the bundles. And why will my project page not delete the bundles? I don't know what
submitted in your dummy one.
Yeah,
there's one already submitted.
Got something submitted. So if they've already submitted stuff, you can't delete it. They'll if you haven't sent the emails, you can delete stuff. Now, you just go back and uncreate the bundles. That'll be here, and there'll be an action here that says undo, and you will be able to undo that that recipient. But you have to get them out of the bundles in order to delete the recipient. I just don't have one that's in that state that I can do it with.
Okay.
Yes, I see the comment from Sarah there, being willing to share her documentation, and we appreciate that. Anytime you can avoid reinventing the wheel, we totally support that. So thanks, Sarah, for being willing to share what you've done with others in the same boat as you are.
I was going to say, Sarah's going to get as many emails as Michelle after this call. What other questions do folks have? We've got about 9 minutes left. Happy to take more questions, or if there's nothing more, give you a few minutes back in your day. Okay. I'm not seeing anything else come in. Okay. Hypothetically, if we've only incurred admin costs, no project bundle set up yet, does the reporting period for this report start on the date we start incurring costs for admin?
You don't even set a reporting start date, because the reporting start date has to do with the CSV uploads. So your period started whenever you started expending money, as long as it was after 1/21, and you're just going to go in and say you've expended funds, show us the funds you've expended by 9/30, and submit it. That's all you have to do.
Shay said, thanks for letting me crash this party for Kentucky. Not seeing any other questions come in and no hands raised. So if we want to call this, William, Michelle?
Yeah, I think we're good to stop here. You guys can always send in AAQs. You can participate in the regular office hours we have on Fridays, ask questions there. I am usually lurking in the background and can answer a lot of the ESG-CV reporting questions. So we just want to thank you. You guys are doing a lot. We know, again, the reporting is kind of a pain. We are not going to lie about that. But we're with you as well, and we're going to try to do our best to do what we can to make it as simple as possible. And you already saw it. We didn't really succeed in some of that, but we're trying. We'll do our best to help out. So feel free to ask questions. So thank you again.
Thanks, everyone.
Goodbye.